Physique assessment. The question our expert panel addresses is: what is MRI useful for? Associate Professor Gary Slater.
So MRI is an excellent technique for a range of different applications. It's invaluable for being able to assess the cross-sectional area of a particular body part. Again, that could be really valuable when you're looking at things like disuse atrophy and the restoration of lean mass on a particular body region. But it's also a reference technique for being able to assess visceral adipose tissue. And there's no radiation exposure associated with it. It's just difficult to access and quite expensive when you are able to access it.
Dr. Kagan Ducker.
Tend to think of MRI as something that's useful particularly for research type areas. You get a very accurate picture of exactly what the body's made up of in those areas. But obviously with the cost attached to that, it's something that you can't always access, but if you really want very fine detail about what the body's made up of in a visual perspective, that's something that MRI is quite good at.
Professor Tim Ackland.
MRI is an imaging tool for hard and soft tissues. We can use it for estimating the subcutaneous adipose tissue as well as the deep depots of fat. Though expensive to capture and analyse images, MRI is one of the few machines that allow us to look at the deep fat depots as well as volumes of other tissues like muscles and organs.
Associate Professor Masaharu Kagawa.
MRI is useful in terms of understanding fat distribution pattern of a particular region of body, and usually it differentiates visceral fat or visceral adipose tissue, subcutaneous adipose tissue, and also able to determine or depict presence of what we call ectopic fat.
For further information on physique assessment, see our book, Best Practice Protocols for Physique Assessment in Sport, published by Springer.